So I'm Debbie Parkinson. I'm the Patient and Public Involvement Lead for the Innovation Agency, and I'm part of the team that works with Dave. And my background is in education, but mainly in citizenship. So I did sort of PPI, patient public involvement, but for young people in education. So this is a similar role, but in health. We work with everyone in the Innovation Agency. We work across all staff and all programmes, and we involve patients and public members wherever we can to get involved with co-production, reviewing items, piloting, doing trials of innovations. And I just love seeing people getting something out of it and seeing new innovations, testing new things. I get quite excited about that. And Dave and I have worked together before. We've known each other for about 7 years. So we know each other and we know the way each other works. So we've just sort of fallen into the work together really, which has been really good.
Yeah, it's been nice, really easy, sort of comfortable working relationship. I'm Dave Dewhurst. I am the Patient and Public Involvement Officer working under Deb. My role is to go out, meet people, bring them into customer forums, help them have their voice inside the NHS and assemble groups of people that can road test equipment, devices and all that kind of thing. Give us some actual feedback and co-creation. What I like most about my job is people. To be honest, I love going out, meeting people, getting them involved in the actual co-creation of devices and having their voice in the NHS. Working with our PIES group has been probably one of the most rewarding things for me. Seeing how involved those people are in putting their voice into the NHS, having that feedback, giving that information to people so that they can make the right choices for the people that live in the areas being served. So PIES is our Patient Involvement and Engagement Senate. It's our little nickname for them, well Debbie's little nickname for them because they existed before I was in post. It's our group of people that we get to come together to discuss any issues that need to be raised in their areas, or to directly look at new pieces of tech or gadgets that are being brought into the NHS, or to give us feedback on the performance of various initiatives and things like that.
And we try to involve members of the Innovation Agency staff into PIES as well. So they can come and meet the members of the public and the patients and involve them in their work streams. So for instance, we had a gentleman that came to work with the patient safety meeting yesterday. They get involved with that, so you always get the patient voice, and you can probably see the wall behind us has patient involvement in it as well. So that's part of the work that we do, not all of it, but we run a group of atrial fibrillation ambassadors as well, or AF ambassadors, and we've utilised Dave's skills already as a trainer, and he's been out training ambassadors, testing pulses to prevent strokes. And we do small events. Last night I went to a bingo club and tested some elderly people as part of Global Aware Week, but in a couple of weeks' time we're going to an Everton home game. So we test lots of people, and probably over the last 12 months we've tested over 2,000 people with about 89 positive results, which has helped prevent stroke and save lives as well. That's good, isn't it?
Yeah, I forgot to mention my background, didn't I? I was going to do that at one point. Oh well. Yeah, it was in the setting of training, education, development for people that had been long-term unemployed, had physical or mental health issues, and were looking for slightly abstract solutions to their need for a job. So they might have, they might not be able to fit into a standard office environment because of social interaction issues. So we'd try and identify types of work that would fit around them, rather than trying to shoehorn them into a job that wouldn't fit.
And that's sort of what we've done with some of the PIES members, because we've tailored their involvement around their needs. So we've got COPD patients involved in Connected Health Cities, and we've got atrial fibrillation patients involved in being ambassadors and stroke ambassadors as well. So we've done a similar sort of thing, but just within the NHS, haven't we?
Yeah.
So this is our premise really, is that our whole remit within Innovation Agency is to get people to have their say in their treatment and in things that affect them within the NHS.